Hello, good afternoon to all of you. My name is Favona Sane. I'm in GBS program, COED 2024. I'm your presenter. I'm here to make PowerPoint presentation based on a dementia patient. Here you go. My first slide is talking about the tree. So I'm gonna explain what the tree symbolize, what it means. I, I call it Alzheimer's and dementia family tree. As we are aware, Alzheimer's and dementia are sadly a growing concern for many people around the world. So basically, that's what it means. Like, my second slide here is talking about how people view dementia people and what kind of perspective they have towards a dementia patient. So I'm gonna go ahead and explain. Because someone has a dementia, it doesn't mean they can have an active life. So in summary, while dementia itself does not directly affect the immune system, individuals with dementia may be more vulnerable to infections due to various factors associated with the condition. By providing comprehensive care and addressing the potential infection promptly can help maintain the overall health and well-being of individuals with dementia. My next slide is talking about understanding dementia, like a guide for patient and caregiver. Dementia, a journey of understanding and support. Dementia, an umbrella term for a range of conditions that affect memory, thinking, and behavior, can be challenging diagnosis for both patient and caregiver. While there is no cure for dementia, that's true, we all know that there's no cure for dementia. But here's the thing, there are steps or things that we can take to manage symptoms, improve quality of life, and provide support to those affected. What is dementia? First of all, dementia is not a normal part of aging. It is a progressive brain disorder that affects the ability to remember things, think clearly, and make sound decisions. It can also lead to change in behavior and personality. My next slide here is talking about type of dementia. We have different type of dementia. So type of dementia, there are many different types of dementia, but the most common are number one, Alzheimer's disease, vascular dementia. We have what is called frontal temporal dementia. So I'm gonna go ahead and explain what is an Alzheimer's disease. The most common type of dementia account for about 60 to 80% of cases. For about vascular dementia, this one is caused by damage to the blood vessels in the brain, often as a result of stroke or high blood pressure. Frontal temporal dementia, this one affects the frontal. It's something that has to do with the brain. It affects the frontal and the temporal lobes of the brain, leading to change in personality, behavior, and language. The next slide is talking about the signs and symptoms of dementia. What are the signs and symptoms of dementia? Symptoms of dementia can vary depending on the type of dementia and the severity of the condition. Some common symptoms include number one, memory loss. Of course, we all know that because that difficulty thinking, change in behavior, language problem, Memory loss in the sense that the person has difficulty remembering events, things like events, conversation, or place, places. Difficulty thinking, trouble meaning trouble concentrating, making decisions, and solving problems. Change in behaviors in the sense that it increased, they are always stressful, it increased agitation in them, anxiety, social withdrawal. Like they don't social withdrawal in the sense that they don't want to associate with people, they want to be always by themselves. Language problem as well. So they have a speak problem, difficulty finding the right words to speak in a right way, or lose the ability to understand others. The next slide here is talking about diagnosis and treatments. Diagnosis and treatment. Early diagnosis and assessment of dementia is important because it allows for early intervention and treatment. There is no cure for dementia, as I mentioned before earlier in other slides, but there are treatments that can help manage symptoms and improve quality of life. If you are concerned that you or your loved one may have dementia, it is important to see a doctor. That's number one advisor. But there are other ways we can manage it by taking, drugs, medications, or drugs like cholinesterase inhibitors, anti antipsychotics drugs, you know, antipsychotic drugs, you know, in some instances, healthcare provider may prescribe antipsychotic medication to manage behavioral symptoms, although their use require careful consideration of potential risks, which means they have a very, very side effect. My next slide here is talking about the role of caregivers. As we all know, caregivers play a vital role in dementia patients' environment and dementia patients' life. Caregivers play a vital role in the life of people with dementia. They provide support, number one, care, and advocacy. Caregivers can be challenging, but there are resources available to minimize or to help. First of all, number one, building a collaborative support is number one. Communication is the key. So we're gonna go about, I'll explain what is communication mean. So communication is the key. Regular communication among doctors, nurses, and pharmacists ensure a cohesive care plan. This collaboration allows for prompt adjustment to the treatment approach based on the patient evolving needs. Holistic care is another priority. A comprehensive approach that considers the physical, emotional, and social aspect of patient's life. This involves not only managing symptoms but also addressing the broad impact of dementia on the individual's well-being. So I'll go ahead and explain in details. Communication. Overall, communication plays a crucial role in dementia care. By building connection and trust, reducing frustrations and anxiety, improving the quality of a care. It improves the quality of the care and supporting the emotional well-being of both patient and caregiver. My next slide is talking about supporting patient and the caregiver. Care for a loved one with dementia can be emotional and physically demanding. Here are some tips for supporting both patient and caregiver. Number one, create a safe and supportive environment. meaning make sure the home is free of hazard and easy to navigate. Number two, establish a routine. Maintain a consistent schedule for meals, activities, and bedtime. Number three, engage in stimulating activities. Stimulating activities in the sense that encourage mental and physical activities such as puzzles, games, and exercise. Number four, seeking professional help when needed. Seeking professional help when needed. Don't hesitate to seek support from healthcare professionals, dementia care specialists, and support group. The next slide is talking about patient and caregiver. Patient and caregiver. Educate yourself about dementia. The more you know about the disease, the better equipped you will be to manage it. Get regular checkup. Early diagnosis is important so that treatment can be started as soon as possible. Create a routine. Like a consistent routine can help people with dementia feel more secure and less anxious. Encourage physical activities. Things like regular exercise can improve mood, cognitive function, and overall health. Provide support, provide opportunities for mental stimulation. Things like engage in activities that stimulate the mind, such as puzzle, games, and reading. Another one is promote social interaction, which is very, very important. Social interaction. Social isolation can worsen dementia condition or symptom. Encouraging participation in social activities and maintain connection with loved ones is very, very important. Create a safe and a supportive environment in the sense that remove all potential hazard from the home and provide easy access for necessary item. Easy access in the sense that entries, in its staircases, and stuff and so on. Speak professionally when needed. Consult with a healthcare provider or, or dementia care specialist for guidance and support. My next slide is talking about the crucial role of communication in dementia. So I'm going to go ahead and summarize this real quick. Making effective interaction between caregivers and patient and is an essential component of quality care. Understanding the importance of communication fosters a supportive environment that enhances the overall well-being of both individuals. Building connection and trust is the key. Emotional bond in the sense that help caregivers and patients connect emotionally. Trust grow when communication is open and understanding. Understanding needs. Good communication lets caregiver know what the patient needs, providing cares that suit them, reducing frustrations and anxiety, clarifying expectation in the sense that clear communication help patients feel less worried when they know what is happening. It reduces confusions and frustration. Last and final slide is talking about conclusion. Conclusion. Dementia care is a complex. By working together, healthcare providers, including doctors, nurses, and pharmacists, can form a strong support team that provides comprehensive care, guidance, and support to patients and their families. Navigating the challenges of dementia and striving to maintain quality of life. For, for dementia care, Good communication is key. Good communication is like a strong foundation. It's number one in the life of dementia patient. We should take note of that. It helps caregivers understand and support patients, create a positive and enriching experience for both. Regularly adopting regularly adopting how we communicate and so compassionate care as need change. Effective communication is the cornerstone of dementia care. Building a bridge because building a bridge of understanding and support between caregivers and patient. It enables caregivers to empathize with patient experiences, provide tailored assistance, and anticipating in their needs. By adopting communication strategy as the patient condition progress, caregivers ensure that their care remains compassionate and effective. Compassionate and effective. So, in conclusion too, it is important to solve problem concisely and to the point in order to effectively address the issue at hand. This approach allows for clear communication, efficient problem solving, and ability to focus on most relevant aspects of the problem by avoiding unnecessary complexity and provide straightforward solution. We can achieve more effective problem solving. And that's the end. I thank you all for your kind attention.